So I'm often asked, what is the preferred chemotherapy treatment that we should be giving to patients when combining it with radiation for those with stage 3 disease? We know that for patients who have stage 4 disease, we commonly give a 2-drug chemotherapy regimen. One of those drugs is a platinum agent, either carboplatin or cisplatin, and then the second drug really depends upon the histology or the particular subtype of lung cancer the patient has. Today, if a patient has an adenocarcinoma, that chemotherapy drug is most oftentimes going to be pemetrexed. And if a patient has a squamous cell cancer, that drug oftentimes will be either paclitaxel or docetaxel or gemcitabine. So how did those drugs behave, or how do those drugs work in the stage 3 setting? Well, we've learned some lessons. First, we've learned that it's very difficult to give one of those drugs, gemcitabine, in combination with radiation therapy. So as a result, we've largely been giving paclitaxel and carboplatin. Some people use docetaxel, although most of the data is with paclitaxel. And more recently, people are using pemetrexed and cisplatin. And historically, we've used cisplatin and etoposide because that was, in previous years, our standard of care for patients who had metastatic disease, but really was the most well-established regimen when giving radiation combined with chemo in the stage 3 setting. So in the United States, the two most commonly used regimens is cisplatin and etoposide combined with radiation, or carboplatin and paclitaxel combined with radiation. So which regimen should we preferentially give? Well, those two regimens have never been compared head-to-head. We have looked at a number of clinical trials in which different strategies have been tested, but never the strategy of testing those two regimens head-to-head. Now, we've recently gotten indirect evidence on what is the efficacy or the effectiveness of those two regimens and how would they compare if we were to do head-to-head comparisons. And these analyses suggest that it probably doesn't make much difference, that the regimens are probably very, very similar. Most recently, there was a clinical trial of cisplatin and pemetrexed with radiation against cisplatin and etoposide with radiation, and that head-to-head comparison really showed no difference in outcomes between those two strategies. So today we can say that really any one of those regimens is reasonable. Some people are wedded to the cisplatin and etoposide regimen because it's what they've most been familiar with and they understand how to handle the side effects. Lots of people like the convenience of carboplatin and paclitaxel because it's given weekly, and some people are drawn to the newest regimen, which is cisplatin and pemetrexed. But I really don't think that there are discernible differences. There may be some differences in the side effects, but I think in terms of outcomes, they all seem to be fairly comparable.